Hello and welcome to Worlds Apart. An old saying has it that nature heals while doctors take the fee. But our guest today argues that doctors' relationship with money has come into direct conflict with nature's ability to heal. How blurry is the line between healing and killing? Well, to discuss that, I'm now joined by Dr. Peter Gotzsche, director of the Nordic Cochrane Centre. Dr. Gøtzsche, thank you very much for your time.
Thank you.
Now, the central thesis of your work is that people in the developed world consume too many drugs, and quite often it's the drugs rather than pre-existing conditions that end up killing them. How big is the problem?
It is an enormous problem. It's one of the biggest problems we have in the world today, but people don't realize how terrible it is. I have estimated that our prescription drugs are the third major killer after heart disease and cancer. And I have recently looked at psychiatric drugs, and these drugs are so harmful that they alone are also the third major killer after heart disease and cancer.
Now, you yourself have a very, very interesting background because you're a doctor who came to medicine after working for a big pharmaceutical company, after doing some science, and you argued that big pharma is very apt in manipulating both science and the medical profession, essentially turning doctors into the agents of influence, if not sales reps. And I think that's a very, very difficult message for many people to accept, because we would be willing to recognize that the big pharmaceutical companies are just after the money, but doctors, I mean, those people, they promise to do us no harm. Are you being fair on the doctors?
I have given the facts, and the facts are very shocking. In Denmark, we are just around 20,000 doctors, but several thousand Danish doctors are on industry payroll. So this gives you an idea of the scale of the corruption, because very few of these doctors do useful work for the drug industry. They act in some way as sales agents for the drug industry, as you just said.
And I think it's also very interesting that in many countries, in many societies, whether they're Western or non-Western, we have this very reverent attitude towards doctors. And actually, historically, if you look at it, healing has always been tied to some sort of belief, whether it's religion or something else. I mean, healers were always believed to have some magical powers. I wonder if there is still this, you know, the remnants of this very reverent attitude towards the medical profession, when we believe that they have some almost magical powers over our health, and that we don't really question their advice as we wouldn't question, for example, religious authority.
We have a good deal of confidence in our doctors, and that is a good thing. We generally trust our doctors and believe they will do what they can for us. But what people forget is that what doctors know about drugs is more or less what the drug industry has told them. And we know that the drug industry is not honest. And if you ask people, they have so little confidence in the drug industry that they rank them at the bottom level together with automobile repair companies and big oil and the tobacco industry. So people have no confidence in the drug industry. And the error they make is that when the doctor tells them to take a drug, they believe in this because they believe in their doctor. But they should ask themselves, where did my doctor get his or her knowledge from? From the industry I don't trust. So patients should be much more careful and not take so many drugs as they do.
Absolutely, and you just mentioned a number of industries, and what struck me is that you know, much of your criticism centers around the United States, and the American economic model is built on overconsumption, whether it is automobile industry or oil industry, and one may argue that the same sort of rationale is being applied here, but I think you go a little bit further in suggesting that this willing or unwilling collusion between the pharmaceutical and medical establishment is aimed at not just supplying and perhaps oversupplying the market, but actually expanding that market endlessly and turning everybody into patients. Do you see that as a product of sort of market forces running awry, or perhaps a deliberate decision, a deliberate strategy on the part of pharmaceutical companies?
It is like you have just described it, and psychiatry is a very good example. Top psychiatrists in the United States are very often on industry payroll, and I call them corrupt in my new book about psychiatry because they let the industry do everything for them. The clinical trials, and the industry analyzes the trials, and even inventing new diseases. There is a close collaboration between top American psychiatrists and the drug industry, so that if you have a psychological problem and you go to an American psychiatrist, it will be very difficult for you not to come home with a diagnosis and a prescription for a psychiatric drug. This has gone completely out of control. Even in my country, people take so many psychiatric drugs that every 10th Dane could be in treatment for their whole life from they are born till they die. It's even more. It's 1 out of 7 actually, if they just take one drug each, that can be in treatment for their entire lives. Excuse me, but I find this insane, because these drugs have many terrible harms, including that they kill a lot of people.
Now, Dr. Gøtzsche, the U.S. Food and Drug Administration plays no small role in it. And as I was researching this topic, that reminded me of the current obesity epidemic in the United States that essentially started with FDA's drive to replace fats with carbohydrates back in the 1990s. And, over time, the FDA recognized that advice was based on faulty science, and then the policy was turned around. Do you expect the same turnaround on prescription drugs? Because at the end of the day, it's the public healthcare system that will have to deal with all those over-medicated patients.
Yeah, we have seen very many errors around recommendations about our diets. You are absolutely right about this. And there are many similarities between the food industry and the drug industry. None of them has any concern about people's health. They just want to sell their products, which is understandable. But to say that the drug industry works for patients is completely wrong. They work for money and profit. And by doing this, they create a lot of misery and a lot of death. And speaking about the Food and Drug Administration, they don't protect the public sufficiently, and other drug agencies don't protect the public sufficiently. And they are far too much on the drug industry's side, and they accept being manipulated by the drug industry. And I can give you one example that a high-ranking FDA official, he published a paper that built on FDA data, and where he found 10 times as many suicides on antidepressant drugs than what he published 5 years later when he still worked for the FDA. Mm-hmm. But that time the FDA had asked the drug industry to look in their files how many suicides they had, and report back to the FDA that did not check whether the information was correct. So the same FDA official reported 10 times less suicides 5 years later.
Mr. Gøtzsche, my theory here is that perhaps that FDA official was also on prescription drugs, and that somehow affected his memory. I mean, that is also possible, essentially because, you also claim that those drugs have a power of changing the brain architecture. I'm just joking here, but this is indeed a very serious matter. You mentioned that there are a lot of similarities between food and drug industry, and I think there is another industry that we have to mention, the tobacco industry, which also, a couple of decades ago tried to manipulate the science and tried to persuade the public that its product wasn't harmful, and sometimes there were even claims that it was beneficial to smoke. Now, when the United States government moved to ban some of the practices of the tobacco industry within the United States, that industry moved to other countries and employed pretty much the same tactics. So my question to you here, what would you recommend to non-Western governments as they think about how to regulate their policies? Because obviously American pharmaceutical companies are very, very strong around the world, and even if they are banned or reined in within the United States, perhaps they will try to do the same around the world.
Oh, that's not my experience. The situation in many non-Western countries is actually worse than in the United States, because in some countries it's easier to corrupt those who work at drug agencies. Mm-hmm. So they sometimes get dangerous products on the market that don't exist in Europe and the United States. So I'm not sure I agree with you.
Mm-hmm. Okay, one of the measures that you suggest that could alleviate this problem is that drug tests should be made a public enterprise, and that all raw data should be free. And I'm not a specialist, but I would imagine that this is not a hard thing to do, and perhaps not an overly expensive undertaking. But I would also guess that this is something perhaps that drug companies object to the most.
Well, if you look at it in an economic way, it would be far cheaper for our societies if drug development and marketing became a public enterprise. Because what the drug industry does now is that it abuses its monopoly. When Somali pirates take hostages, they might say that they want 1 million of some currency for each hostage. But what the drug industry does nowadays is that it sometimes says, we want 1 million for each person every year, year after year. We just saw a new drug for cystic fibrosis that even cost 2 million Danish crowns a year, and that is year in and year out. So the drug industry extorts us in a way that is far worse than what the Somali pirates do, actually. And therefore, if we made it a public enterprise, we would save a lot of money, because we could also show that a lot of these terribly expensive new drugs actually are not better than old drugs if we did our own clinical trials.
Mm-hmm. Well, Dr. Gøtzsche, we have to take a short break now, but when we come back, has the myth of a panacea cure-all been replaced by the idea that there is a remedy for each and every condition? That's coming up in a moment on Worlds Apart. Stay tuned. Welcome back to Worlds Apart, where we are discussing overmedication and overdiagnosis with Dr. Peter Gotzsche, director of the Nordic Cochrane Centre. Dr. Gotzsche, I know that you are not very popular among psychiatrists. You already mentioned that, and one of the reasons for your low popularity is that you claim that this profession is most implicated in drugging their patients for prolonged periods of time, and sometimes even for life. You also believe that that's not only unhelpful, but that could also be harmful. Can you elaborate on that?
Yes, I explained before that psychiatric drugs kill very, very many people, and they don't have such benefits that they are worth all the death. That's very clear. So in my view, psychiatric drugs, the way we use them today, definitely does far more harm than good. If you then look at those who don't die, you also harm them. I have studied the scientific literature quite carefully, and my conclusion is that likely all psychiatric drugs in the long run, if you take them for a long period of time, can lead to chronic brain damage. Some psychiatrists will tell you that it is the depression and schizophrenia that destroy the brain, and when you get drugs, you can prevent brain destruction. That is not correct. Psychiatric diseases don't destroy the brain, but the drugs do.
Mm-hmm. Dr. Gøtzsche, I think you also claim that in this particular field there is, more obvious complicity of the medical establishment, because we can see from the DSM, from the progression of DSM editions, that the criteria for diagnosing, for example, depression and other mental health conditions have been consistently lowered. And I want to quote you something that one example, one anecdote that you give in many of your lectures. You mentioned that in the latest DSM edition, allows psychiatrists to diagnose depression after just 2 weeks of bereavement since the death of one spouse. And, you know, to most of us, that would seem like a joke if the subject wasn't so grave.
Well, it actually was a joke on my part. In the edition from, I think it was 1980, then you were allowed to feel sad for 1 year before it was a depression. In the next edition, it was 2 months, and in the latest edition, 2 weeks. So my joke was, why not 2 days in the next version?
Yeah, absolutely. And you also joke that, you know, what kind of a marriage should that be if you are not allowed to grieve for your deceased spouse for more than 2 weeks? I mean, that's, even if the marriage is awful, I think you would have some adjustment longer than that period. But speaking of which, I wonder, you blame the pharmaceutical companies for pushing with the sort of laxing of these diagnostic criteria, but I wonder if that's also a cultural thing, because my experience in the United States has been that Americans do have this affinity for quick fixes. You know, whether it's in foreign policy or medicine, they always want to do something, and they believe that action is always better than non-action. So I wonder if that's also part of the reason why doctors simply feel more comfortable prescribing something rather than waiting a little bit longer to investigate.
Well, there is definitely this cultural issue with America, and overuse of drugs is worst in America, but it's very bad in our part of the world as well. So the difference is not that large. For example, in Denmark, we take so many antidepressant drugs that every one of us can be in treatment for 6 years of our lives. Do you believe that every Dane is depressed for 6 years or has serious anxiety for 6 years of their lives? Of course, that's not true. So it's not only a question of culture, it's very much a question of industry marketing, and also a question of people having forgot that what psychiatry should really be about is not drugs, but psychotherapy, about human understanding and empathy, learning people to cope with life's difficulties. That's what psychiatry should mainly be about, and not drugs.
Mm-hmm. And I also think that one of the central points that really resonated with me that you make is that sometimes we just should allow nature to take its course, and sometimes people recover, because their bodies recover without any medical intervention.
Yes, and this is certainly true for depression. A depression doesn't usually last very long. Most people recover in 6 to 8 weeks or 3 months or so. And then quite few get a relapse of depression within the next year or two. But nowadays, when you put people on antidepressant drugs, they become addicted to them. So it's difficult for people to get off them, for many people. And if they try to get off them, they may get withdrawal symptoms that can be pretty terrible, including depression, actually. And then patients and doctors, they think that this is because you are still ill and need to go on with the drug. So nowadays, many people take antidepressants for many years, and some take them for the rest of their lives. This is very, very sad.
Mm-hmm. Absolutely, and I think that addresses that issue of trying to medicalize pretty much everything. And to that, in that regard, I would like to ask you a little bit off-topic question, but I still think that it relates to sort of allowing nature to take its course. I found that it is extremely, well, I wouldn't say extremely difficult, but that it is difficult in many countries, in many Western countries, to have a natural birth. I think many doctors in your societies have a sort of a bias towards C-section, which they believe to be better paid, it takes less time, and they claim that it is less risky for perhaps the doctors. I don't think it's the same for patients. And I wonder if that's not yet another example that, you know, market forces, if you allow them to function by themselves, they sometimes skew healthcare priorities, because I think it is pretty you know, understood across the board that it is better to have natural birth when you don't have complications, and yet there seems to be a bias in many developed countries towards pushing patients towards surgical outcomes.
That is true. Among wealthy women in Brazil, I think that more than half of them give childbirth by a cesarean section. So they get an operation. And this is sad because people think it's harmless to get an operation, but that's not true. It gives them more harm to be operated than to give childbirth naturally. Mm-hmm. So I'm worried about that in my country now. Women can choose whether they want to have a natural birth or a cesarean section. And I believe it can be discussed whether women should have this choice unless there are particular reasons, because it is definitely more harmful to have a cesarean section.
Mm-hmm. And Dr. Gøtzsche, I think there is one more outcome here, one more factor that we need to discuss, is that in many countries that tried to move away from C-section, they found that obstetricians no longer have that skill set. That is the case in Turkey that I'm aware of, at least. I wonder if that applies to medical profession in general. If drugs is your first choice, isn't it also true that, you know, your other medical skills may not be in such a big demand, and that after a while you actually, you know, the quality of doctors, the quality of medical profession seems to decrease, even though, you know, we live in the era of scientific progress?
I'm smiling because I believe this is a strawman argument put forward by a Turkish obstetrician who wants to go on doing cesarean sections. You know, there are always difficult cases where doctors will recommend a cesarean section. So I am convinced that the obstetricians, they will get the training they need, even if they try to restrict the amount of cesarean sections. This is a non-argument.
Okay, let's move to another very serious question that you raised a couple of times, and I'm talking here about excessive pre-screening for breast cancer. You believe that it picks up both benign and malignant tumors, and as a result, more people are subjected to unnecessary treatment. What is your advice for women? Just relax and come what may? I mean, what are you recommending here?
At our center, we have probably looked into more depth about these trials of mammography screening than anybody else. And so we have studied it a lot. And one of the things we have studied is that for screening to work, the whole idea is to find breast cancers before they have become too large. And both our own studies and studies from other countries have shown that screening doesn't do that. It doesn't decrease the amount of women who have large tumors, which means that then screening cannot work. But if we assume that there is a small benefit in terms of breast cancer mortality anyway, then you mentioned that many women have harmless cancers that would never have come to their attention for the rest of their lives. And screening predominantly detects all these harmless cancers. But since they all look like dangerous cancers in the microscope, you treat all of them. For example, with radiotherapy. And when you treat healthy people with radiotherapy, you kill some of them. Mm-hmm. They develop lung cancer or heart disease and other cancers, so you kill some of them. So if we assume that screening has a minor effect on breast cancer mortality, it seems to me that this is counteracted by more death among the healthy overdiagnosed women. So in total, there is no survival benefit by going to screening. So I would recommend women to not go to screening.
Mm-hmm. Well, I'm sure this recommendation would raise lots of objections with the Russian doctors, because in this country we have lots and lots of doctors lamenting that people, and women in particular, wait too long before asking for medical help. So when they actually discover that they have cancer, it usually at a pretty advanced stage, and as a result, I mean, and this is also data that has been internationally published, the prognosis for Russian women post-treatment is much lower than, let's say, for American or European women. So I would agree that moderation is the best, but I wonder if you believe that waiting for too long could be just as harmful as, let's say, this excessive vigilance.
It's not correct. I must say that your Russian colleagues, they have not studied the scientific literature in sufficient depth, because, as I told you, the science shows us very clearly that mammography screening doesn't work. It's actually harmful because it renders a lot of healthy women into cancer patients that are getting treatment unnecessarily. So more and more people in our part of the world have realized this. And I have a paper in press called something like "Mammography Screening Should Be Abandoned," where I explain the latest science, which, in my view, is quite clear.
Well, Dr. Gøtzsche, unfortunately we don't have more time for that, but I really appreciate your being on our show. And to our viewers, please let us know what you think on our Twitter, Facebook and YouTube pages. And I hope to see you again, same place, same time, here on Worlds Apart.